Hi, are you struggling from overweight or obesity? So what exactly is obesity and how do we define obesity? And what are the options in front of us if we need to fight obesity? So let's talk about this today. So I am Dr. Hrishikesh Salgaonkar. I am a full-time obesity and weight loss surgery specialist at Fortis Hospital, Mulund in Mumbai. So as we know, the incidence of obesity is increasing world over. अगर आप last 2 या 3 decades में देखें तो even in India the severe obesity rates have increased by 2 to 3 times and today it has reached epidemic proportions. So what are the options in front of us? Yes, diet, exercise, a good physical activity and following a healthy lifestyle is the most common thing and most easiest thing that we can do. But हम जब research देखते हैं and when hundreds and thousands of patients के किए हुए studies देखते हैं, what we know for sure is patients who suffer from severe obesity. And what do I mean by severe obesity? So whenever based upon your height and weight, we do calculate something called as body mass index. When your body mass index is more than 32.5 and above, we categorize this as class 2 and class 3 obesity. So when you have class 3 obesity, that is a BMI of 37.5 and above, you are directly become a candidate for obesity or bariatric surgery. At the same time, if you have a BMI of 32.5 and above, and if you have an obesity associated chronic medical issue, which can be type 2 diabetes, hypertension, raised cholesterol, reflux disease, joint pains or back related issues. In young females, we can have issues such as PCOS, PCOD or infertility, and some other medical issues such as obesity, sleep apnea disorder. In all this disease, obesity surgery can definitely help you. So what are the types of obesity surgery? Two most common types of obesity surgery that we do is one is what we call as a laparoscopic sleeve gastrectomy and the other is what we call as a Robotic gastric bypass. So हम क्या करते हैं इन operations में exactly? So in all of this operation, our goal is to reduce the capacity or storage size of your stomach. So in sleeve gastrectomy, we remove almost 80 to 85% of your excess stomach out of the body, as a result of which आपकी stomach की capacity severely reduce हो जाती है. At the same time, by reducing your capacity of your stomach, you eat less and it also creates certain positive hormonal changes, as a result of which you eat or drink less and you don't feel as hungry as before. Whereas in a gastric bypass, we don't remove anything out of the body. In a gastric bypass, हम stomach में एक छोटा सा pouch create करते हैं at the top, which is about the size of a large egg. And फिर हम जो आपकी distal small intestine होती है, we bring that up and we join it to that pouch. So the entire goal is, by creating a tiny pouch, you eat less food, and because we have bypassed your intestine and joined the pouch to your intestine directly, all the calories that you are eating, not everything is going to get absorbed. So we are intentionally creating a component of what we call as malabsorption. There are some other types of bariatric surgery also, such as mini gastric bypass or one joint gastric bypass, or surgeries such as duodenal switches. Obviously, when you come and meet us and our team of bariatric experts, we can go through details of every surgery and go through the pros and cons that every surgery has to offer for you. There are some other weight loss surgery options also, such as endoscopic gastric balloons. So what we do here is, doing an endoscopy, we insert a balloon inside your stomach. The problem with this is, we can only keep the balloon inside your stomach for 6 months to 12 months. Eventually it has to come out, and the moment it comes out, the risk of regaining weight is always back there. There are some new weight loss medications also on the market, but what we know for sure is the benefits of this are good when your weight is not very severely high. So it may help you lose about 5 to 10%, at times up to 15% of your excess body weight. But this may be very good tool in patients who are not as obese. So in patients whose BMI is less than 32.5, what we know for sure is in patients in whom the BMI is more than 30.2.5, the benefits of these drugs are slightly less as compared to thinner individuals. It is good to come and meet our team of experts at Fortis Hospital so that we can go through all the options, go through all the pros, cons, benefits and risks of all these options and procedures in detail. So don't hesitate to get in touch with us. Thank you so much.